PSA test. Explained. Everything you need to know. Hey guys, Dr. Lucy Cherry here. So, you just received your blood test results. You look at that PSA number and suddenly panic sets in. The number seems a bit high. You wonder if it's cancer. Someone mentioned a biopsy, and honestly, that scares you. Breathe, gentlemen. You're in the right place. With over 25 years of experience in urology, I've seen thousands of patients in exactly your situation, and today, I'm going to explain everything from A to Z. Let me be direct. An elevated PSA does not automatically mean prostate cancer. That's what everyone believes, but it's wrong. In my daily practice, the majority of men who come to see me with a slightly high PSA simply have a prostate that's grown with age or a small inflammation. Nothing dramatic, but of course we need to verify and monitor. What is PSA? PSA stands for Normal PSA Values by Age. Normal values depend on your age. In general, we consider PSA below 4 nanograms per milliliter normal. But it's more nuanced because your prostate naturally grows with age, so your PSA values increase too. Here are the benchmarks I use in my practice. Ages 40 to 49, below 2.5 nanograms per milliliter. Ages 50 to 59, around 3.5 maximum. Ages 60 to 69, up to 4.5. Over 70 can reach 6.5 without necessarily causing alarm. These are averages. Every case is individual. PSA total versus PSA free. A crucial distinction. When you have a blood test, we generally measure total PSA, all the PSA circulating in your blood. But this PSA exists in two forms: a portion bound to proteins, bound PSA, and another portion that circulates freely, free PSA. Why does this matter? Because the ratio between free PSA and total PSA helps distinguish benign prostatic hyperplasia from possible cancer. In cancer, there tends to be less free PSA relative to total. Factors that can temporarily elevate PSA. There are many things that can raise your PSA temporarily with no connection to cancer: age and natural prostate growth, prostatitis, prostate inflammation, urinary infection, recent sexual activity, ejaculation within 48 hours before the blood draw can artificially elevate PSA, cycling, horseback riding, or any activity putting pressure on the prostate, and rectal examination just before the blood draw. My advice to patients: before your PSA test, avoid sexual relations for 48 hours. Avoid cycling and sports that put pressure on the perineum. If you have a urinary infection or inflammation, wait until it's healed before measuring PSA. When to really be concerned. My personal criteria after 25 years of experience: below 4 nanograms preventing PSA elevation. Naturally, there's no miracle remedy, but yes, certain things can help maintain a healthy prostate. Cooked tomatoes rich in lycopene, scientifically proven to have a protective effect on the prostate. Broccoli and other cruciferous vegetables. Green tea. Pumpkin seeds. Saw palmetto. Turmeric with a pinch of black pepper for better absorption. Regular physical exercise is essential, but avoid excessive cycling if you already have prostate problems. The seat presses on the area and can worsen inflammation. And obviously, limit alcohol, quit smoking if you do, and maintain a healthy weight. Obesity is a risk factor for many prostate problems. Looking for daily prostate support that's natural and effective? Shilajit Wellness. Nest contains the trace minerals, antioxidants, and fulvic acid your prostate needs. Our Canadian customers report improved urinary function and overall vitality. Add it to your daily routine alongside these healthy habits. Q&A from the clinic. Q. I masturbate once